Thank you very much indeed, and thank you for inviting us to speak at what I understand is the 9th Keratoconus conference. I've been asked to give a sort of overview about eye research in the UK, which I will do, and then I will hand over to my colleague Rubina, who will talk more specifically about what is happening in research around keratoconus. For those of you who don't know Fight for Sight, we're the main charity in the UK that funds eye research. We don't compete with you here. We're not offering support or services or information. We're all about funding medical research. And we've got a commitment of about £8 million to research at 44 different UK institutions, mainly universities, but also some hospitals right across the UK. And it's estimated that over 2 million people in the UK are affected by sight loss, and that over 50% of those people, their sight loss is avoidable, normally by having an eye test and getting the right prescription, or perhaps by cataract surgery. And one of the interesting things I think about the sight loss sector is that if you look at the register of charities, there are over 1,200 sight loss charities here in the UK. And they tend to fall into three categories, realistically. There are those that deliver support and services in the UK, and this could be at a national level, a regional level, a very local level, but also those, like the Keratoconus group, that are very specific to one particular condition. And there are charities that raise money in the UK and spend it overseas. We think of people like Sightsavers, Vision Aid Overseas, recognising that there are millions of people in the world with sight loss that actually is treatable. But our aim is to fund research, and to fund research so that we can have a future that everyone can see. And if we just look at the broader need for research, the figures from WHO are that there are 253 million people worldwide with some form of sight loss. And of those, 36 million are blind, and 217 million people in the world have moderate to severe visual impairment. And there's been a massive change over the last few decades. We've seen the prevalence of infectious eye diseases reducing significantly. The development of antibiotics addressing things like trachoma, and drugs addressing things like river blindness. But having seen a decline in the number of people affected by these infectious eye diseases, what we're actually seeing is an increase in the prevalence in age-related conditions, and particularly now in developing countries as life expectancy is increasing, but also particularly around the areas of diabetes and diabetic eye disease as well. I mentioned that the 2 million people in the UK with sight loss, over 1 million with avoidable sight loss. So for all these people in the UK and worldwide, that is why we need medical research. There are many different eye diseases and conditions that we still don't know what causes them. We still don't have any treatments, or we still don't have ideal treatments. We may have some treatments, but they may not work for everybody, and they may not be the kindest of treatments either. So who funds eye research, and why are we existing as a charity? Well, you might say, why don't we leave this up to companies? Why don't we leave this to the private sector, to pharmaceutical companies, to biotech companies? Because, of course, the reality is that actually, whilst they do fund research, they exist, in a sense, to make money out of doing so. And a lot of conditions, eye diseases and conditions, and health areas in other sectors as well, that early stage research is very risky. You can put money into early stage research, but you do not necessarily know whether you are going down the right pathway in trying to understand about a particular condition. And so you need people who are prepared to invest in research, because what they want is patient benefit, not a financial return. And the people that invest in that early stage research that's risky, where there is absolutely no guarantee of any financial return, are effectively patients working with charities and government. And if we look at the figures, government spend 20.3 million on eye research in 2016-17, and that represents about 1% of total government spend. So eyes are getting 1% of total government spend. If you look at Wellcome Trust, the largest medical research charity, they spent 10.5 million, which represents 1.4% of their spend. So again, eyes getting just over 1%. And what's also quite interesting is if you take the largest 15 UK sight loss charities, their income totaled £422 million in 2016-17, but only 10.2 million of that was committed to medical research. So the challenge is really on to raise funds to get research funded. And we at Fight for Sight will fund research that aims to address sight loss from any eye disease or condition. And we are very keen to work in partnership with other organisations. And that's why we're delighted to be working with the Keratoconus group and to be able to jointly fund research. Because actually, you want research, you've raised money for research, and what we want to be able to do is to match those funds so that we can double up and put more money into keratoconus research. And we're doing the same with many other charities, both in the sight loss sector, but also working with people like Diabetes UK, Alzheimer's Research UK, other conditions that where there may be some similarities between disease or the other diseases may be linked to sight loss in some way. And in terms of the research that we fund, I mentioned that we fund researchers that are attached to recognised academic and medical institutions, primarily in the UK. We fund some overseas, but the UK is a leading centre in the world. We may not get anywhere near as much money as, for example, is put into eye research in the States, but actually, if you look at the different measures of output, you look at the clinical trials that are taking place here in the UK, you look at published academic papers, you look at some of the world's firsts. They have been happening here in the UK. And so what we want to do is to select the best. We have limited resources, so we want to ensure that the money that we are spending is really well used. And so we select research grants through a competitive process. Researchers have to compete for the funds. And this was exactly the same with the partnership that we've just got with the Keratoconus group. Researchers compete for our funding so that we know that we're funding the best. And we put this through what's called a peer review process, which is asking experts, is this good quality work? Is this good quality science? Is it based on the right data? Do we think this is good value for money? And then what we make sure is that we assess the impact of the research that we funded. It's not just a case of giving a researcher a grant and saying, just come back and tell us if anything happens. This is about actually being able to drive the impact that we want from that piece of research. And of course, all the eye research that we fund here in the UK will not only benefit people in the UK, but the millions of people affected worldwide. And we have a model. We are very clear about what it is that we want to achieve. And in some eye diseases and conditions, it's going to be easier to try and find a way of preventing them in the first place. For others, that may be more difficult. We may not know what causes them. And so what we may be looking for is a recognition that those eye diseases and conditions will exist, but we want that early stage intervention that stops them progressing and stops them going on to sight loss. And in other conditions, if you think about cataract in a sense, that is about being able to reverse sight loss. And if you can do one of those three things, either prevent the condition in the first place, intervene at a really early stage, or reverse sight loss, then fundamentally you are able to reduce and eliminate that as a cause of sight loss going forward. But in all three of those areas, you need to develop that intervention. You need to ensure that there are regulatory approvals, because it's all very well developing something, but actually if it never reaches patients, it's nice to have. We need the health service to deliver those interventions, and we need to ensure in particular cases that people comply with those interventions. And so at Fight for Sight, we're very keen to fund the research, but we're then very keen to ensure that we use our influencing ability to make sure that whatever comes out of that will actually go through the necessary processes to be delivered to patients. And people often say to us, but isn't research phenomenally expensive? And how can a charity of your size actually have any impact? How can small amounts of money actually have any impact in really making a difference for patients? And I just wanted to give one example. Choroideremia is a very rare inherited retinal disease. And 10, 12 years ago, there was very little research going on into choroideremia. It's a condition which blinds men. It runs through families and blinds men, normally by the time they're in their 40s. And we were approached by a lady called Emma Salisbury, whose son, at that time was 5, had been diagnosed with choroideremia. So she knew that by the time he was in his 40s, he would be completely blind. So she came to see us and said, what can we do? There's no treatments, there's nothing in clinical trials. What on earth can we do? So we said, well, we need to have the wherewithal to be able to spend some money, but we need to invest that really wisely in some very early stage research. And that is precisely what we've done. And we got together families with choroideremia, and we funded some early stage research in models in the laboratory about choroideremia at Imperial College in London. And that enabled the researcher then to be able to collaborate with a researcher at Oxford University to get a £1.1 million grant from the Department of Health to be able to undertake the world's first clinical trial of a treatment for choroideremia. The team were then able to go on and get a further grant, a £1.6 million grant, again from the Department of Health, to do what's called a phase 2 trial. And at this point, the private sector starts getting involved because suddenly we've taken all the risk, not all the risk, we're not there yet, we've taken some of the risk out of this potential treatment. And so there was a spin-out company from Oxford University. That company has gone on to raise over £100 million and is now investing that in a phase 3 trial to try and take gene therapy for choroideremia all the way through to the clinic. So without Fight for Sight, without the patients with choroideremia who supported Fight for Sight, we would not be in the position that we're in today. This drug still has to go through phase 3 trials, so we're not there yet, but we are in a completely different position from where we were 10, 12 years ago, all thanks to people getting together and saying, this is what we want. So thank you. I wanted to end on a positive note there, and I'm going to hand over to Rubina, who's going to say more about what is happening in keratoconus research. Thank you very much.